Hello, everyone. It's Dr. Nicole Rochester, board certified pediatrician, professional health advocate, and CEO of Your GPS Doc. This week is Patient Safety Awareness Week. And you may be saying, why are you so excited about Patient Safety Awareness Week? Well, mostly because this gives me and many others an opportunity to share information with patients and their family caregivers so that you can be safer in healthcare environments. Today's tip is all about medications. So many people take prescription medications, over the counter medications, supplement medications, and a lot of us really aren't aware of what we're taking and why we're taking it and how those things may interact with the foods that we eat and the supplements that we take. So today I want to talk with you about medication safety. Every single one of you should have an accurate and up-to-date medication list. One of the things that I remember so vividly when I was a caregiver to my late father is that he had so many specialists and so many of them would prescribe medications, sometimes duplicates of things that he was already taking. Maybe he was already on 3 blood pressure medications and he'd go to the emergency room as an example, and his blood pressure would be high. So they would tack on another blood pressure medication. And then maybe he'd go to the cardiologist, but the cardiologist didn't know that the ER doctor 5 days ago had given him a new blood pressure medicine. So then he would give him yet another blood pressure medication. And my dad suffered lots of side effects and unnecessary symptoms, largely due to the many medications that he was taking. So this topic is near and dear to my heart. So it's very important that you keep an accurate and up-to-date list. Accurate meaning every single medication that you are taking needs to be on that list. And up-to-date meaning that this is an active process. When your doctor stops something, or when they add something, or when they change the dose of a medication, you need to go back to this list and update it. So what is the information that you need to include on this medication list? Number 1 is the name of your medication. I know that many of us refer to things as the blue pill or the square pill or the white pill, but we need to know exactly what medications we are taking. So make sure that you know the actual name of the medication that you are taking. The next thing you need to know is why you're taking that particular medication. I have talked to so many clients and their family members, and they're taking these medications and they don't really know why, and they just take it because this doctor told them to or that doctor told them to, but it's not really clear to them why they're taking it and how that medication fits into their overall health. So anytime a doctor or another healthcare professional is prescribing a medication for you, always ask, hey doc, what is this medication for? What is it going to do? What is it going to help treat? How is it going to help me? Okay? The third thing you want to know is the dose. You want to be very clear. Are you taking a half a tablet? Are you taking 2 tablets? And you also need to know the frequency. Are you taking this medication once a day, twice a day, at bedtime, in the morning? This is very, very important. The next thing you need to know is, how are you taking this medication? Are there any special instructions? As an example, is this something that you're supposed to take on an empty stomach? Or is this something that you're supposed to take with food? Are there certain things that you need to avoid? Are there certain types of juices? For example, there are some medications where they say, don't take this, with citrus juices, pineapple juice, things like that. There are other medications where they may say, hey, this medication may work better if you take it with a fatty food or if you drink milk with this medication. So those are things that you need to know. The next thing you need to know is, how long are you to take this medication? Sometimes, like if we think about antibiotics as an example, you're only supposed to take that medication for 10 days or for 14 days. And then other medications are meant to treat your chronic illnesses, and those are things that you need to take every single day. Those medications you cannot run out of. So you need to be very cognizant about calling in your refills or doing mail order so that things automatically come to you before they run out, okay? The next thing you need to know about are the side effects. Are there certain reactions that you can expect from this particular medication? Maybe a medication will cause you to have a dry mouth. Maybe a medication will cause you to be a little bit lightheaded or a little bit dizzy. And as a result of that, maybe there are certain precautions that you need to take. You also need to know about interactions. And this is why it's so important that you maintain an accurate and up-to-date list, because sometimes medications don't do well with one another. And the only way that your doctor is going to know that is if they know what you're taking. And many times, the only way they'll know what you're taking is if you know what you're taking. Keep in mind that when you're going to various doctor's offices, sometimes they don't communicate with each other well. Sometimes those consultation letters get lost. Sometimes they don't get uploaded properly in the chart. Sometimes this electronic medical record doesn't communicate with the other electronic medical record. And so you and or your family caregiver may be the single source of truth when it comes to your medications. So you need to make sure that your doctor has that information. And also the pharmacist can be a wonderful resource when it comes to managing and detecting and preventing these medication interactions. All right, so let's just quickly go through this one more time. The things that you need to know about your medication so that you can stay safe. You need to know the name of your medication. You need to know why you're taking the medication. You need to know the dose and the frequency of your medication. You need to know if there are any special instructions associated with that medication. You need to know the duration. How long are you to take that particular medication? You need to know if there are certain side effects that you need to worry about or look for. And then lastly, you need to know if that medication can potentially interact with other medications that you are already taking. I hope that this has been helpful. I encourage you to share this video with others. And if you want to get my free medication guide so that you can easily and effortlessly go through and document your medications, print it out, keep it in your purse or keep it in your pocket when you go to doctor's appointments, or take a picture of it or store it on your phone, then you can go to bit.ly/GPS medlist. All right, you all, take care. I'm going to be bringing you quick patient safety tips all this week. So be sure to come back to this page every day this week for more information. Take care.